Hypoglycemia is far more than just low blood sugar, it's a clinical emergency that arises from a complex interplay of multiple factors. Many people mistakenly believe that only individuals with diabetes face blood sugar fluctuations, when in fact, due to poor dietary habits, imbalanced exercise routines, or various internal and external stressors, anyone can be at risk for hypoglycemia. This video will explore the primary causes of low blood sugar from several angles and, using vivid case examples, offer practical advice for preventing and managing hypoglycemia, helping you safeguard your health in everyday life. 1. Dietary insufficiency and irregular eating, an imbalance in nutritional supply. Maintaining a stable blood sugar level largely depends on eating regular and nutritious meals. However, busy work schedules, intentional dieting for weight loss, or deliberate calorie restriction can lead many people to skip meals or significantly reduce their eating frequency. This prolonged low-calorie intake can rapidly deplete your blood glucose and liver glycogen stores, eventually triggering hypoglycemia. How it happens: your body relies on carbohydrates to convert into glucose, the primary energy source. When you don't eat enough or go for extended periods without food, your blood sugar levels can drop below normal. Additionally, consuming alcohol on an empty stomach further inhibits the liver's ability to release stored glucose, accelerating the onset of hypoglycemia. Case in point, for example, 35-year-old Emily often skipped lunch due to work demands and relied solely on coffee during late-night overtime. One evening, while returning home, she suddenly experienced dizziness, blurred vision, and cold sweats. A visit to the emergency room revealed her blood sugar was dangerously low. After consulting with her doctor, Emily adjusted her schedule to ensure she ate on time and even began carrying small, healthy snacks, like fruit or low-sugar energy bars, to sustain her energy levels throughout the day. Her symptoms gradually improved as a result. Prevention tips. Stick to a regular meal schedule, ensure you have 3 balanced meals a day, supplemented by healthy snacks when necessary. Avoid prolonged fasting, particularly before or after drinking alcohol, as this can exacerbate blood sugar drops. Carry quick energy boosts, keep convenient sources of fast-acting carbohydrates, such as a piece of fruit or a low-sugar energy bar, with you during busy days. 2. Imbalanced exercise, a mismatch between activity and energy intake. Moderate exercise is beneficial for overall health and can even improve insulin sensitivity and help regulate blood sugar levels. However, when extensive or high-intensity exercise is performed without adequate energy compensation, the body's rapid consumption of glucose and liver glycogen can lead to hypoglycemia. How it happens: during exercise, your muscles use up blood sugar and liver glycogen for energy. If you don't restore these supplies with proper nutrition afterward, or if you exercise while fasting, your blood sugar can drop to dangerous levels. For individuals engaging in rigorous activities, the risk is even greater. Case in point, take 42-year-old Brian, a fitness enthusiast who would frequently go for brisk, early morning runs on an empty stomach. One day, midway through his run, he felt sudden weakness in his limbs, rapid heartbeats, and a wave of dizziness. Emergency treatment confirmed that he was suffering from acute hypoglycemia brought on by exercising on an empty stomach. Following his doctor's advice, Brian began consuming low glycemic index foods, like whole grain toast or a piece of fruit, before his workouts and refueled adequately afterward. His symptoms soon subsided, and he continued exercising with proper precautions. Prevention tips. Avoid exercising on an empty stomach, have a small, nutritious snack before engaging in strenuous activity. Refuel appropriately, replenish with complex carbohydrates and fluids after your workout to restore energy levels. Customize your exercise routine, consult with a fitness professional or healthcare provider to develop a plan that matches your energy intake with your activity level. 3. Medication errors, incorrect dosage or timing of diabetes medications. Hypoglycemia is common among diabetic patients, particularly those taking insulin or oral hypoglycemic agents. When the dosage is too high or medication is taken without adequate food intake, blood sugar levels can plummet. How it happens: diabetic medications are designed to lower blood sugar but can overshoot their target when taken in excessive amounts or without proper nutritional compensation. Overmedication may continuously drive blood sugar below healthy levels, triggering severe hypoglycemia. Case in point, consider 55-year-old Michael, who had been faithfully following his doctor's prescription for managing his type 2 diabetes. However, during a period when his appetite was low, Michael failed to adjust his medication dosage accordingly. This oversight led to repeated episodes of severe symptoms, ranging from trembling and sweating to brief losses of consciousness, forcing him to be hospitalized. While under medical care, his medication regimen was carefully altered, and he was advised to always monitor his diet closely and report any changes promptly. Prevention tips: monitor dietary changes. Diabetic patients should be vigilant about how variations in eating habits affect their blood sugar levels. Communicate with your healthcare provider. Always inform your doctor if you experience changes in appetite or meal sizes so that your medication dosage can be adjusted. Keep fast-acting carbohydrates handy. Maintain a supply of quick energy foods, like glucose tablets or fruit juice, for emergency use if you experience low blood sugar symptoms. 4. Endocrine and organ dysfunction, disruption in energy regulation. Beyond lifestyle factors, certain endocrine disorders and dysfunctions in liver or kidney function can also trigger hypoglycemia. The liver, crucial for storing glycogen and generating new glucose, via gluconeogenesis, loses its capability to release sufficient sugar when diseased. Similarly, kidney failure or insulin-producing tumors, insulinomas, can disrupt the delicate balance of blood sugar regulation. How it happens: when your body's organs responsible for energy storage and production aren't functioning optimally, the balance between glucose supply and demand is disturbed. For instance, insulinomas result in overproduction of insulin, leaving blood sugar levels chronically below the normal range and impairing neurological functions over time. Case in point, take 48-year-old Lisa, whose ongoing complaints of unexplained weight loss and frequent dizziness eventually led to extensive testing. Doctors discovered that she had an insulinoma, a rare tumor that was causing her pancreas to secrete excessive insulin. After the tumor was surgically removed, Lisa's blood sugar levels gradually returned to normal, and she experienced significantly fewer episodes of hypoglycemia. Prevention tips: regularly monitor health markers. Those with known liver, kidney, or endocrine issues should have frequent checkups to monitor key indicators of metabolic health. Watch for hypoglycemia signs. Be alert to symptoms like sudden dizziness, sweating, or confusion, which may signal an underlying issue needing prompt attention. Optimize your treatment plan. Work closely with your healthcare team, endocrinologists, nutritionists, and primary care physicians, to modify your lifestyle and treatment protocols as your body's needs evolve. 5. Special physiological states and emotional instability, increased demand and autonomic dysregulation. Certain life stages and emotional states can also predispose individuals to hypoglycemia. For women, periods such as pregnancy or lactation involve heightened metabolic demands. If nutritional intake does not meet these increased energy needs, low blood sugar may result. Additionally, some younger individuals, particularly women experiencing intense emotional fluctuations or chronic stress, may develop what is sometimes known as idiopathic hypoglycemia, where autonomic nervous system dysregulation leads to unprovoked low blood sugar. How it happens: during pregnancy or while breastfeeding, hormonal shifts and increased energy requirements can tip the balance if dietary adjustments aren't made. Similarly, chronic stress and anxiety can disrupt the normal regulatory mechanisms of blood sugar, making it more difficult for the body to maintain equilibrium. Case in point, for instance, 29-year-old Jessica, while pregnant, frequently experienced episodes of dizziness and low energy due to consistently skipping meals in an effort to avoid weight gain. Upon consulting a nutritionist and her obstetrician, Jessica learned to adjust her meal frequency and nutrient intake to cater to both her and her baby's needs, which effectively mitigated her hypoglycemic episodes. In another case, 30-year-old Ashley, a young professional suffering from chronic stress and irregular sleep patterns, experienced recurrent low blood sugar. After undergoing behavioral therapy and restructuring her daily routine, Ashley's blood sugar stabilized as her hormonal balance improved. Prevention tips. Nutritional counseling for special conditions. Pregnant and breastfeeding women should seek guidance from a nutritionist to ensure their diets meet increased energy demands. Stress management. Techniques such as mindfulness meditation, regular exercise, or counseling can help manage emotional stress and its impact on blood sugar regulation. Establish consistent routines. Maintaining regular eating and sleeping schedules can support a more stable hormonal environment and prevent unnecessary dips in blood sugar. Comprehensive management. Achieving a balanced energy supply. At its core, hypoglycemia arises from an imbalance between glucose supply and consumption. Whether due to insufficient dietary intake, overzealous exercise, medication mismanagement, or underlying health conditions, early recognition, consistent monitoring, and individualized management are the keys to preventing hypoglycemic episodes. Strategies for maintaining balance. Regular meal planning. Commit to eating at fixed times to ensure a constant supply of energy. Incorporate complex carbohydrates, quality proteins, and ample fiber in every meal. Pre- and post-exercise fueling. Consume low glycemic index foods before workouts and replenish energy with carbohydrates and fluids afterward. Medication vigilance. If you're on diabetes medications, monitor your blood sugar levels closely and adjust your medication in consultation with your healthcare provider during periods of change. Routine health checkups. For those with ongoing liver, kidney, or endocrine issues, having regular blood tests and medical examinations is crucial. Attention to life stages and mental health. During periods of increased physiological demand or emotional stress, pay special attention to your nutritional needs and adopt proven stress reduction techniques. Establish an emergency plan. Keep fast-acting carbohydrates on hand at all times, and make sure family members or caregivers are familiar with the signs of hypoglycemia and how to respond. Hypoglycemia is a health risk that should never be overlooked. Its root cause lies in the delicate balance between energy supply and consumption. Whether triggered by irregular eating habits, excessive exercise, medication missteps, or organ dysfunction, low blood sugar can rapidly escalate into a life-threatening emergency if not managed properly. But with a proactive approach, encompassing a healthy lifestyle, structured meal times, smart exercise habits, vigilant medication use, and regular medical checkups, you can effectively prevent and control hypoglycemia. Remember, your health is built one meal, one workout, and one medical checkup at a time. By learning to listen to your body's signals and adopting these practical strategies, you create a robust defense against the risks of low blood sugar. Embrace a lifestyle that prioritizes balance, take charge of your health, and empower yourself to live each day with vigor and confidence.